Hi, I'm Dr. Sean Cooney, and this is your Dental Arch Extra. In May 2016, Dr. Ronald Inge was added to the executive lineup of Delta Dental of Missouri as their first dental director. He brings with him 15 years of experience as a general dentist and over 20 in leadership roles in the dental benefits arena, including serving as the dental director for both Aetna Dental Benefits and Delta Dental of Washington. Recently, I sat down with Dr. Inge at the Delta Dental of Missouri corporate offices in Sunset Hills for a candid conversation about the challenges facing our profession and the future of dental benefits in the modern marketplace.
Dr. Inge, thanks for being with us.
My pleasure.
So how is Delta Dental of Missouri working to strengthen its relationship with its member dentists?
So in the coming months, every dentist in Missouri will be visited by a member of my staff. Our purpose is going to be determining how we can bring value to the dental offices. First thing will be, how can we make it easier for the dental offices to work with Delta Missouri? So we're developing a list now, we'll call it our top 10 list, of what are the biggest pain points the dental offices have with Delta Missouri, and can we provide answers to those problems?
What information have you used to compile that list?
So we're compiling our list from the calls that actually come into our customer service department. So we've already met with our customer service department, identified where those pain points are. Most of them are around collecting benefits and claim submissions. So we're developing brochures and pamphlets and leaflets that we'll be able to come into an office, discuss with the front office staff, and be able to leave those behind to help that staff in terms of how they communicate, making sure that accurate information is being passed, the correct information is being passed, so that it doesn't slow down any processing of claims.
That brings me to a good question. Many dental offices sometimes find themselves wedged between the insurance company and their patients when their determinations aren't made as expected.
Right.
How is Delta Dental working to proactively facilitate the flow of information to the patient?
Okay. That's a real challenge because we work through our clients. Our clients are the employers. We do have the opportunity to provide all the information about their dental benefits plan and how they can utilize it. We continue to work, again, through the dental office because it's the face-to-face interaction between the doctor and their patient where it's critical that information be passed. So as much information as we can give to the dental office so they can speak very clearly to the patient, that's, from my point of view, my department's biggest challenge is to provide the dental office with all that information so that they can have that conversation.
So I'm going to switch more towards the marketplace, the dental insurance marketplace, because I know recently, especially with laws that have recently been passed as far as general health care is concerned, I know that affects dental to a certain extent. How is Delta Dental working to maintain its place, its spot in the marketplace, sort of as, at least in Missouri, as the premier, dental benefit provider?
The marketplace has changed so much over the past 10 to 15 years. In the past, dental benefits were seen as an ancillary product, and most employers felt very comfortable providing that benefit to their employees. Employers began to scrutinize every penny that was spent on healthcare, which created a challenge within the dental benefits industry. So now we have competition that is driving the cost of dental benefits down. So if you have a large employer, they are looking for the best rate in regards to the services they receive. Delta Dental of Missouri has ridden on our customer service as being our differentiator within the marketplace. Now that financial concerns have moved to the top of that, we are struggling to position ourselves not to be the least expensive, but to at least be competitive in our expenses that we charge to our clients. Much of that reflects back to the providers in regards to reimbursement. So where we have challenges from other dental benefits companies where they may have reimbursement levels within the state of Missouri that are lower than our reimbursement rates, that puts us at a disadvantage. So we are working to manage our plan designs and manage our relationship with our doctors so that we can at least remain competitive.
So, in the past 30 years, we've had a dental benefits level that has remained relatively flat. There was a $1,000 maximum 30 years ago. It's $1,500 most of the time today. But the advances in dentistry and the costs of that care have resulted in patients delaying treatment, which is basically makes them a statistic in the access to care crisis because they're not getting the treatment they need because it's financially unaffordable for them to do so. So in what ways how does Delta Dental view that? And in what ways are they working to try to make strides towards, the future of dental benefits?
So when the maximums first started, they were significant for the time. There was a shift within healthcare. And unfortunately, that shift was onto the backs of providers, both medical and dental, in which the companies and the employers were looking at ways to manage their cost. And the first place, unfortunately, was on the backs of the providers. Whenever we go out to an employer, we offer a comprehensive dental benefit plan, and we offer whatever maximum that employer is willing to pay for their individual employees. And that's one of the things that I tell dentists is that the dental benefit is the amount of money that the employer is willing to provide to their employee. When we approach an employer and we offer a higher maximum, the employer will ask, and this is just part of their due diligence, how many of my employees actually exceeded that maximum the previous year? Traditionally, and dentistry is very predictable, that amount is between 3 to 5% of employees actually exceed their maximum. They don't exceed their maximums because they don't want to pay out of pocket, so they hold off on services until the next year when it renews. So now the employer says, well, what does it cost me to raise that maximum? It may cost you 1 to 2 cents per member per month. If you have a large corporation, that's a significant amount of money for 3 to 5% of your employees. From a financial standpoint, the answer is usually no. We're not going to increase it. And that's why the maximums have been very slow in regards to their creeping up. But as long as our economy remains a challenge for everyone, there will probably be very little movement within reimbursement levels across the country.
Thanks for watching the Dental Arch Extra. If you'd like to see more of this interview, click on the left. If you'd like to watch another episode, click on the right. I'm Dr. Sean Cooney, and as always, thanks for watching.